Fantastic. Dr. Cole talked a great deal about the efforts that he's leading around health quality. And they've asked, the department's asked APHA to kind of lead a series of discussions around the integration within the medical care community and the public health community around health quality. And can you talk a bit about how each of your agencies is really reaching out to that challenge and supporting the quality initiative? Obviously, you've done a lot of things over the years, but looking forward, what do you think we need to be doing?
Well, I think that at the Indian Health Service, we're pretty good at measuring the quality of clinical services because we have had this ability to measure through our electronic health record for so long. I think that one challenge that we face with public health is figuring out how to measure it, how to have consistent measures, and how to be able to compare care across the continuum. Prior to being the director of the Indian Health Service, I was working with the National Indian Health Board on a project related to the public health accreditation. And I think that a part of that is just the need to look at improving quality as sort of a continuous process as you deliver both healthcare and public health services. And so I think it's critical that we figure out ways to measure quality of the public health services that we provide. In the Indian Health Service, I know that we have been doing that for some time, but we need to do a better job at it because we need to be able to demonstrate to our patients that we are providing quality in the name of transparency, but also in the name of doing the right thing and translating that information into things that people can understand, not getting in front of tribes with complicated PowerPoint presentations and, a bunch of statistics and those sorts of things, but translating the information we have into quality into something that our patients can understand and appreciate and help them make healthcare decisions. So I think we have, as those of us in both medical and public health, we have a lot of work to do to find some really good ways to measure and communicate quality.
I would just second what Yvette has said, and then also make just a couple of additional comments. One, with regard to HRSA, HRSA has historically been known as the access agency, the access to health care. I've always found that to be a bit incomplete. And so when I talk about HRSA and its mission, it's really access to quality health care. It isn't access to any care. It's access to the highest quality health care for the patients that and populations we serve. So first of all, it's to put a new, to strengthen that orientation toward access to high quality care, again, for our most vulnerable populations. We're not talking about anything other than first-class, first-rate care. Part of that then means that we need to be doing an even better job of collecting, tracking, and helping our grantees, communities we're working with, et cetera, to monitor and improve their performance, even as we monitor and improve our own inside the Health Resources and Services Administration. So it's an additional focus on measuring performance and on making those measures, that data, actionable. You're going to see some new data reported out of HRSA that will give an even better sense going forward of the quality of care that our patients inside our health centers are receiving, inside the clinics, our HIV Ryan White HIV/AIDS clinics are receiving. So it's really about measurement, using data, and then working together in partnership with grantees, local associations to drive toward improved, higher quality care. It's not about just giving care. It's about driving toward higher quality. And within HHS, by the way, we're certainly working with Dr. Coe, working with Carolyn Clancy to strengthen that orientation toward quality, really leveraging the resources across agencies in an orientation toward high performance. Yeah.
Thank you. What do you need from us?
Everything. Everything. Everything you've got to give. I'm sorry, I should have self-censored there. But I'll just start this one out because I'm so enthusiastic about being here. So first of all, it's in response to the invitation to be here. Well, thank you. And it's about helping us and knowing that we could not be more sincere. And I'll speak on behalf of my colleagues at HRSA and the expectation of this administration that we're working in partnership with people outside of the agency, that the reservoir of what things should be done and how they should be done does not all reside inside the federal government. We're only going to do a great job, not a good job, but a great job, if we're doing it in partnership and harnessing everything you know. If you identify for us the things that we could be doing more effectively and efficiently, we're open for business. We're absolutely open for business. It's about a refresh, new orientation to our work. We can't do it nearly as well if you're not there partnering alongside of us. We need your expertise in public health and community health. I laid it bare to you when I said to you on the front end, this is not an audience to say, gee, I come out of a critical care background and feel comfortable in. But so to suggest to you that we rely on your help as an organization and as individuals at the local level, working with us to improve the work that we're doing on behalf of a very shared mission. So we'll be working forward. We've actually been at APHA twice, I'll just say. In the 7 months that I've been with the administration, your organization has been terrific in leading a Friends of HRSA group of about now probably 100 different associations attending meetings at APHA, working with us to problem solve, enhance our productivity, our efficiency, and so thanks to what you've done with us as partners already, and we'd invite a whole lot more of that, Dr. Benjamin, going forward.
Thank you.
So sorry, I was ready to jump out of my chair just to reinforce that message. Yvette.
I agree completely. I think that we can improve the health of our communities without working together. I think one of the things I learned in my public health training and having worked in public health for many years is one of the greatest joys of working in public health is the partnerships that we form and work together. And one of the greatest frustrations we have is when those partnerships don't work very well. So I would like to encourage us all to continue to work together to improve the health of our nation. And think of unique partners that you may not have had before. How many of you in the day-to-day work that you do have encountered an issue related to American Indian, Alaska Native health or tribal health? Raise your hand. That's why we need you as APHA, as an organization that helps bring the various stakeholders together that relate to the health of our nation and encourage us to talk and share what we're doing and to open lines of communication and to think about creative ways to improve our nation's health. We have to work together in order to improve the health of our communities. These next few years are really exciting times where there's a lot more hope and possibility than we've had before. It's really a unique opportunity, and I encourage us all to do what we can to work better together, to work as effectively together as we can, and take advantage of this really unique and hopeful time in our country's history.
Ladies and gentlemen, I'd just like to give a great round of applause to Dr. Yvette Roubideaux and Mary Wakefield, partners in public health.